Hi, welcome back on Anne's Health Talk. Today we're talking about COVID-19 in developing countries, and we have three special guests. It's Shakil Farid, who is a cardiac surgeon joined from Oxford, and Zahid Ikram is an elderly care and general medicine consultant from West Sussex, UK, and Tasbirul joined from USA, Indiana. He is intensive care doctor in USA, and so far we have talked a little bit about the symptoms and signs and a little bit about the treatment. And before we go into the next bit, we're going to play a special video. This is taken in my hospital. It is one of our students.
My name is Yusuf. I'm a student ODP. In the current situation we are with this coronavirus, this is how I gown, this is how I dressed up doing my job. I think this is very challenging because it's very difficult to communicate with your colleagues with the mask on, and at times with the breathing it's very hard, but there's nothing we can do. This situation we find ourselves with the pandemic going on at the moment. We just have to get on with it and do the job, protect ourselves and protect our patients, and look after one another and keep NHS safe.
Okay, welcome back. This is what we do in our hospital in UK. What do you guys think about this PPE kit, what we have here? Zahid?
Sorry, I couldn't see the video properly.
Oh, sorry, you couldn't see the video. Anyway, I say it's about full PPE kit, I'm sorry, I didn't realize that you could not play our program while we're talking because it get interference. That's fine. Anyway, so we showed what we use in the UK is full PPE kit, full face cover, and the mask and gown and everything. That's fine. We can jump into the program. Okay.
Tell you a bit about that. So, you know, the PPE that we recommend for Bangladesh is generally level 1 PPE rather than this, and the full cover with the FFP3 mask. Those we generally say that those are better for aerosol generating procedures. Generally level 1 PPE, which is more basic, is what we recommend.
Okay, excellent. Zahid, let's talk about drugs and any new development in drugs. What's happening there in that avenue?
I think before we talk about new development, we should emphasize that the main drug for COVID-19 is still oxygen. And generally, you don't need any drugs until people need oxygen. So I will still go back to that. Oxygen is a drug, and that's what we mainly use for COVID-19. And also on patients requiring oxygen, well, you've heard about the recovery trial results, which are, it's a very preliminary report. It's like a press release. It's very difficult to jump to conclusions on the basis of that because we don't have the full data. But they have said that it's saved lives if you give it to patients with severe or critical disease, meaning patients who are on oxygen. If you give it to mild symptoms, it's going to kill more people than it saves. That's pretty much for certain. And then once you go beyond this, other drugs that's useful in patients who have severe disease is thromboprophylaxis, like low molecular weight heparin. So that's another thing that we recommend.
That's important. Do they use thromboprophylaxis in Bangladesh?
It is being widely used now.
Excellent.
Because I think people understood that this is important. But again, this is not for mild disease. This is for patients who are coming to hospital. Or ill enough to require hospitalization. So the other one that's come to the fore is remdesivir, but because it hasn't showed a mortality benefit in the trial, we are not strongly recommending it, but it is being given for patients, again, with severe disease. That's where it has a role. It's an antiviral agent, but really we need to see whether it has a mortality benefit. And finally, the other one which is being used is convalescent plasma. Again, waiting for the evidence on this. And what sort of patients might benefit from this. It is being widely used, but again, the evidence, we'd rather wait for that. All the other drugs, I think, are not useful. None of them have shown any benefit. A lot of them are given in mild disease, and people are claiming, make wild claims. Those claims need to be disregarded. A lot of things coming on the internet, like papers which haven't been peer-reviewed, being put online, and people jump into conclusion, and millions of people taking these drugs on the basis of that. that's inappropriate.
That's excellent. Would you be able to summarize the names of the drugs you talked about so people can remember it?
So we would not recommend hydroxychloroquine, chloroquine, azithromycin, doxycycline, ivermectin. So things like that. We would certainly say favipiravir is another one. No evidence of benefit so far. So without
no evidence, yep.
For more severe illness, there are some drugs like tocilizumab which can be used, but those are for people like Tasbirul to use in ITU. Those are not for people like me to use.
So people for day-to-day symptoms, like mild flu-like symptom, we still don't have a specific drug. Is that right?
Just take paracetamol and monitor yourself. Yeah.
Take paracetamol and monitor yourself. That's a good advice. Okay, let's talk about Shakil. What's happening in Bangladesh? Do we have enough ITU beds, ventilators?
That's a big problem. In Bangladesh, I mean, Tasbir might be able to correct me if I'm wrong. To the best of my knowledge, there are around 400 to 500 ventilators. There are around 12 to 1300 IQ beds in the whole country.
500 ventilators for the whole country, is that right?
For the whole country, and there are around 12 to 1300 intensive care unit beds for 160 million or 180 million.
160 or 180 million people, okay.
Now, the bigger problem is even if you give thousands of ventilators now, and even if you make thousands of IQ beds, it's not going to solve the problem because they don't have enough trained manpower. So in most of the Western countries, you will see there is a high dependency unit. So between the ward and the intensive care unit, there's an intermediary area where you can give CPAP, BiPAP, advanced oxygen support, without giving ventilatory support. Now in Bangladesh, that is completely lacking. So I think for a country like Bangladesh, the way forward is to develop medical-led high dependency units where patients can have advanced oxygen support, such as CPAP, things that can actually improve your lung function and that can prevent you from going on a ventilator. Because if you look at the mortality, even in the Western world, it's around 49-50% for patients who are on ventilators. In a country like Bangladesh, it's around 80 to 90%, if not 100%. Wow. Whereas, if you can prevent patients from going to a ventilator, that will save a lot of lives. I'm sure Tasbir Bhai can give us...
Yeah, that's what I'm going to ask Tasbir. What can we do for this?
Thank you so much again. Yeah, I was listening, Shakil, for you to give exact real data in Bangladesh. I want to say something, some positive note. So Bangladesh has a lot of achievements. So if you look at the GDP, it's highest in the that region. If you look at the Southeast area, over 8. If you look at the garments, we are second in the world after China. If you look at the poverty level, is below 20% now. If you look at the extreme poverty level, is below 4%. If you look at the literacy rate, it's over 70%. If you look at the life expectancy, is 72 years. That is in 1971. When you liberated in 1971, it was 47 years. So it's now 72 years, the life expectancy. We have a lot of achievement. But I agree with Shakil Farid that the health sector got neglected. So that needs to improve because we need to invest. If you look at the budget, only 5% of total budget is for the healthcare only. It should be at least 15%. If you compare with GDP, it should be at least 5% of the GDP should go to the healthcare. We are spending only 1% of the GDP. So that is the unfortunate thing that we need to plan it. We need to increase the budget. We need to get the right people, visionary, transparency, honest, accountable person and dedicated person. I'm pretty sure we can go up. Look at our vision. In 2041, we actually have a plan to become developed country. That is the plan. Actually, we're heading towards that way. If you look at the other parameters, we're doing great, but in healthcare sector parameter, we're doing poorly. We need to improve, and we should have 5 years, 10 years, 15 years, and 20 years plan. I'm pretty sure is a wake-up call now. And we need to wake up now. We need to have a vision. We need to have the budget allocation, proper budget allocation. And I'm pretty sure we can achieve that goal. So in summary, now at the moment, we cannot develop ICU overnight. No chance.
True.
Because we don't have the manpower or the man behind the machine. We need to train doctors, we need to train nurses. Our number of nurses, number of doctors really pathetic. If I give you the number, you'll be scared actually. For every 10,000 population, we have 5 doctors. Every 10,000 population, we have 3 nurses. So really, we need to increase the number significantly.
What is the problem here? Why are there not many people studying medicine or nursing, or what is this problem with the income issue?
So no, I graduated in 1992. So when I graduated from medical school, we have only 8 medical schools at that time. So now in 2020, we have 111 medical schools.
111 medical schools, that's amazing.
Yeah. So it's increased, but look at the population. We have 180 million population,
right.
Number one. Look at the nurses. The problem with the nursing in the world, if you look at the developed country, the nurse to physician ratio should be 3:1. Every 3 nurses, there should be 1 physician. That is the norm. But in Bangladesh, it's different. Our nurse is much less in number than physician. 86,000 physician in comparison to only 56,000 nurses in Bangladesh. The other thing is retaining is the problem. We cannot retain doctors. Number 3 is, unfortunately, in government sector, 30% of the positions are vacant because of the funding issue. That should be addressed as well.
So you're talking about the funding, first of all, and to make people stay in Bangladesh and treat their own patients. But you guys are doing a great job, I think. Even you're living in abroad, and you still consider about your country, and you produce this manual, and you're advising on doctors. It's a great job.
Thank you so much.
And this whole program is about that, and hopefully people watching, and they will understand what you guys trying to do and what is your message. Okay, let's say, how do we protect, Zahid? How can we protect our grandparents, parents, and how can we advise the Bangladesh population, all the Asian population on this issue?
So yeah, I can talk a lot about that because I have an elderly mother in Bangladesh who I'm trying my best to protect from a distance. So basically the way to protect our older population is to ask them to isolate. They must stay at home, especially if getting frail. If they get sick, it will be very difficult for them to get through the illness. So they must stay safe by isolating. They must restrict access to other people who are going to come into their homes. So people should not be coming in and out all the time. Anyone who comes in must wash their hands, wear a mask, and maintain a distance. So essentially by isolation, by maintaining that 2-meter rule, hand washing, cleaning the environment, cleaning the house properly on a regular basis with appropriate material. And also, we need to do our bit to keep them safe. Like if we are going in and out and not following the rules properly, then we are going to carry the illness into the home. So essentially, that's the way to protect them. Once they get into the hospital, they are out of our hand.
So in Bangladesh, it's a quite concentrated country, isn't it? People living close together. How practical is it for them to wash their hands just before going into the house? And how possible for them to keep this 1-meter distance while they're talking to their family or friends?
So yeah, that is difficult, and that's why I think it would be appropriate in Bangladesh for people to wear a mask even inside the home. And if you can't wash your hands, you can use the alcohol gels to keep your hands clean. That works almost as well, and I would suggest that. So and essentially keep the house clean as well. But also, you should yourself not. Even when you go out, if you follow the rules properly and wear a mask outside, keep your hands clean, try and maintain as much distance as possible, go out as little as possible, then also you'll protect older people at home.
But if it's as possible, if they could meet their family and friends outside in an open space, the infection will be reduced, isn't it?
Yes, in an open space, the risk is much less.
Yeah. That's true. That's true. Okay. Shakil Bhai, can you talk a little bit about your area, the heart disease and COVID?
Yeah, it's a quite complex and broad issue. I will just try to give you a brief overview of the situation. So, if I answer your question in two parts, first one is effects of COVID on heart, and second part will be what happens to patients with pre-existing COVID, pre-existing heart disease.
Heart disease and COVID, yeah.
Yes. So, we know the pathology of COVID, that it causes inflammation of the heart, especially on the third week, second to third week, because of inflammatory response. It also causes thrombosis, which can be clot in big arteries or in small arteries, like coronary arteries. And on top of that, many patients have dehydration, they don't eat and drink properly, so they get electrolyte imbalance. All these factors can have really negative effects on the heart. It can cause arrhythmias, it can cause heart failures, it can cause inflammation of the heart, giving rise to myocardial shock, those kind of things. So these are very complex problems. And the second group of patients are the patients with pre-existing heart problems who develop COVID. Now, these patients are at higher risk of mortality. One of the things that I've noticed during the lockdown, when we were doing only limited surgery or limited procedures, that a lot of patients with heart disease would just stay home. And even if they got pain, chest pain or any other symptoms, they wouldn't tell us because, they are too afraid to go to the hospital. So what we did in our hospital is every patient who was on a waiting list would get a phone call from our pre-op nurses every 1 to 2 weeks to find out how they are doing. And by doing that, we have actually brought a lot of patients to the hospital because they were having unstable angina and they would just remain home without contacting us. They were too afraid to come to the hospital or call us because they were expecting that we won't operate on anyone in this COVID situation. So I think these are the patients who are at highest risk.
What's your message in simple terms for people to remember?
Simple term message is, if you have heart problem, if you are having symptoms, please seek help. Don't stay home. Do not be afraid to come to the hospital. Yes, you can get COVID if you come to the hospital, but you may die at home if you don't come to the hospital with heart problem.
That's very good. Okay, Tasbir, let's talk a little bit about plasma therapy. Is it something going forward?
All right, thank you so much again. If you look at the serum therapy, it actually is dated back in 1891. So first it is used against diphtheria. Until mid-30s, it used for all kind of bacterial infection until we got the antibiotics in mid-30s. So it is well-known therapy for many diseases. So if you look at SARS, if you look at MERS, we used the convalescent plasma. Unfortunately, it did not work against Ebola. So now we are using, if you look at the data, such as I can give you the big data on the Houston, that's in Texas, Methodist Hospital, they showed actually significant benefit of this convalescent plasma. If you look at the Hackensack University Medical Center in New Jersey, they use actually over 500 patients, and they found actually is beneficial. But there is the data again showed it doesn't work, such as the latest paper came out in JAMA from China. Actually, it was terminated before because they want to recruit 200 people, but they recruit only 103 because the COVID-19 is gone virtually in Wuhan area. But they found actually it does not help the severely ill or critically ill patient. So my take, in my experience, when I used in my patient in my hospital, actually I saw the benefit. And actually we use 1 unit of plasma for non-ICU patient. Somebody is in ICU, we use 2 units of plasma, 12 hours apart. And the benefit is seen actually at third or fifth days. After 3 days or after 5 days, you see the benefit. So in summary, yes, it is an antibody. So it should work, and it's like a vaccine. Vaccine means you're given vaccine to produce the antibody by the patients on its own, but the antibody is just giving the preformed antibody to fight against the virus. It should work theoretically, but important thing is to find the donor. That's very important because only they found 20% of the recovered COVID-19 patient actually has good antibody response, only 20%. So 80% doesn't have a good enough antibody to take to become a donor. So that is one. Donor scarcity is a problem. And number two is if you look at the titer, it has to be at least 1 to 160 titer. Unfortunately, in Bangladesh, except in Dhaka Medical College, the place I graduated, other than Dhaka Medical College, nobody looking at the titer. They just give the plasma without knowing whether his antibody titer. So giving antibody with a low titer is not going to work. So in summary, again, I think it's promising, as Dr. Zahid Ikram says, that we need more data. And actually, none of them are randomized control trial so far. So we need more data to figure out if it's working or not working. But theoretically, I think it should work.
Theoretically, it should work. But first of all, we should find someone who had already had the disease or who had produced somehow antibodies, and that should be the plasma we should use. And we should check the antibody titer. Is there how much antibody is there? Is that right?
So there's two ways you can identify the donor. One is confirmed COVID, and patient has to be symptoms free for 14 days before he can collect the plasma. Second is suspected COVID, not confirmed, but after 14 days of symptoms, he can check the antibody. If it's positive, then he can still use the plasma of that person, though it is not confirmed by the RT-PCR. Number three is you should check the titer before you give it to the patient. The titer should be at least 1 to 160.
Can you explain us how they take plasma in simple terms for our viewers to understand?
Okay, so plasma is the fluid component of the blood. So if you see the blood that is red, and red means a lot of RBC, what we do, we take the RBC, all the cell out. There's a WBC, there is RBC, and there is the platelets. So we take all the cells out of the blood. So take the liquid part of the blood, which is like yellow in color. So that is the plasma.
That's excellent. Zahid, finally, how can we stay safe?
Okay, well, whether you might look at it from the point of view of a doctor or as a person in the community. So as doctors, we stay safe when we go into hospital, by wearing the appropriate PPE and trying to minimize contact with our patients, and also maintaining that distance from staff, wearing masks at work. A new thing that we have started, that we are always wearing masks. In the community, the same sort of rules where you go out as little as possible, you wear a mask, you maintain the distance, you keep your hands clean, and also you keep other people safe by maintaining distance. As you said, you pointed out that we should be meeting people outdoors, not indoors. This is going to be a long haul. It's going to go on for a very long time, and we will have to follow these rules for a very long time. Unfortunately, I won't be able to go and watch Liverpool play in a long time, and Shakil won't be able to watch Manchester United play in a long time live. So those are realities that we have to live with.
This infection is not going to finish soon, isn't it? It will go on for probably half a year or a year, or who knows.
Is another Spanish flu.
Yeah,
exactly.
Hopefully the vaccine will come into play within 6 months to a year. Early results are promising, so we are hopeful.
I just add one thing quick here to Shakil Farid. The vaccine thing, I know he's very optimistic. I'm not. Why I'm not, I'm telling you. Because if you look at the Moderna, this is a US-based company, they're making mRNA-based vaccine. That will be the first in the world in the history of vaccine if they're successful. No vaccine yet based on mRNA. If you look at the Oxford one, Professor Sarah Gilbert, they're making vaccine on the basis of adenovirus. That is also not in the world. And so far, in the history of vaccine, no vaccine available or made on the basis of adenovirus. That will be the first one. We'll see.
Let's see.
That's quite promising. Okay, what would you like to give some take-home message? You could.
Thank you. From my point of view, first of all, thank you for inviting us to this program. I really enjoy it here. The message for for Bangladesh will be protect your doctors, give them proper protection. Otherwise, it will be a disaster for the country. Not only the doctors will die, they will also infect their patients as well. It's really important. We can't have a situation where I don't think the disease has even reached its peak in Bangladesh. We have already 40 dead doctors. This is completely, frustrating situation for all of us. And I urge the policymakers to give proper protection to our doctors. Thank you.
This is for the health officials and
Yes.
people in the government, what you're advising. That's a really good advice. Hope they watch our program and hope they will take our advice. Would you like to say again a little bit about your website and your website name? So anyone who is interested, they could go and check.
Yeah, so the guideline is on my website, which is shakilfarid.com/COVID-19. And I re-emphasize that there are very good national guidelines. Our guideline is just to supplement that national guideline. And we have a lot of experts from all over Bangladesh who have contributed to this guideline alongside the UK and USA professionals. Thank you.
Do you have any contact with the government? Are you looking forward into that way, that talk to the government and try to implement or try to support them with that?
Yeah, we have a lot of contacts with the government and different experts back home, and they have been very welcoming, and they have been quite open, and they have been taking our advice as well. It's a learning process. Do not think for a minute that things has been done the right way in England and America. A lot of mistakes have been made. So we are just trying to tell them our experience from the mistakes that we have done in this country. We do not want 40,000, 50,000 Bangladeshi people to die. In this country, at least you have ventilators, you have IQ beds, you have a social support system. None of them exists in Bangladesh. If a doctor dies, his family will suffer. No one will look after his family. So, it's really, really important that, we share our experience, we share our mistakes with them. Thank you.
So your message is mostly, your articles is mostly towards the medical side and how they prevent the infection going around them and how they could prevent the infection going to the patients and how they could treat it. Is that right?
Yeah. I have one more message for the media of Bangladesh. I think it's really important to positive picture of the doctors because, the doctors are going through a really difficult time back home. Right, left, and center, colleagues are dying. Their colleagues are dying or falling sick due to COVID. And it's a very stressful situation. We have been through this situation in England when our friend, Dr. Abdul Mabul Chaudhry, died. A lot of our friends got hospitalized. It was a very stressful situation for us. We can understand what situation they're going through. Every day they're afraid to go to work because they think that, the PP they are getting, are they genuine? Are they gonna get PP? Are they gonna get COVID? And, most of the families in UK are nuclear families. There is husband, wife, and kids. Back home, these are mostly joint families. So if you're working in a hospital, you come back home, you mix with your elderly parents who are in their 70s or 80s, you can infect them. So it's a really stressful situation. So I think the media can play a very important role in getting the morals up for the doctors.
Excellent. Thank you. Thank you very much, Zahid and Shakil and Tasbir. It's amazing to have you guys here, and thank you for your time and taking this effort to come and explain our viewers all about your expertise. And thank you very much on behalf of INTV and our program directors. We'll see you in some other programs next time. Until then, I'm going to say goodbye to you guys, and we'll see you some other times. And thank you guys for being with us. And today we talked about COVID in developing countries. We concentrated mostly on Bangladesh, and this is all about this manual or this book. They produce this along with 50-odd specialists, and how they guide the Bangladesh health officials and the doctors, and we talked a lot about this. And until we see you next time in a similar program, but next week's going to be hypertension, and that's going to follow with cardiac surgery. So be tuned on intv.co.uk. And for today, for being with us, thank you very much. And if you have any questions, you could always write us to healthtalk@intv.co.uk, or you can always write us on our Facebook link. And after all, thank you very much for being with us, and please look after yourselves. Goodbye.